purpose of this video is to provide a brief overview of the various types of rating scales on the evaluation forms you are about to use to rate trainees' surgical skills. A description of each scale will be given, as well as some reference points to assist you evaluate the trainee's performance of simple suture and instrument tie. You will also be given a card detailing the key points for each scale to use as you rate the videos. The first scale is a pass-fail scale. Trainees are simply placed into pass or fail categories, with no further information on performance being detailed. Trainees would rate a fail if they are unable to perform the task independently, or the majority of the steps of the procedure had significant or repeated errors. Trainees are given a pass if they are able to complete the task independently and more or less correctly with few to no significant errors. The next scale is the visual analog scale. Raters place trainees along a graduated line ranging from unable to complete tasks to safely and independently performed. Trainees' performance is marked on a slash, as can be seen with the red line, at the appropriate point between the two extremes. The top end of the spectrum should represent the performance we would expect from a competent surgeon, which is the top goal we hold trainees to, and theoretically the maximum performance. This would be represented by a task performed with all the steps done smoothly and correctly, with no stopping or errors. The bottom end of the scale would be equivalent to someone who failed the pass-fail system and was unable to complete the task or had significant errors. The next scale is the checklist. In this scale, each critical step of the procedure is detailed. Raters check off which steps the trainee performed correctly. Description of the correct performance can be seen detailed beside each point. Briefly, incorrect performance for each point would include, for number 1, grasping the needle too close to either tip and holding the instruments correctly. Number 2, using excess force to jam the needle through the tissue and not following the curve. Number 3, using excess force to pull the needle through and failing to follow the curve with lack of motion at the wrist. Number 4, leaving the tails too long, such as more than 4 centimeters, or too short, or accidentally pulling the stitch through. Number 5 would include those who do not throw the stitch twice around the needle driver. Number 6 would be those who do not cross their hands or who do not have a square knot. Number 7 would be those who throw the incorrect amount of throws after the initial surgeon's knot, or if the suture falls off the needle driver and repeatedly needs to be rethrown. Number 8 would be if the knot is not square and the trainees do not cross their hands. Number 9 would be if the sutures are too tight or too loose and the skin edges are visibly gaping. And finally, number 10 would be if the sutures are cut too long, such as longer than 1 centimeter, or too short. The final scale is the global rating scale. This scale uses a numeric value to rate performance in a variety of categories. Each numerical value is anchored with a descriptive statement regarding its corresponding performance level. Again, the top score of 5 should be assigned to those performing at the level of an independent practicing surgeon. The scale specifies that trainees are to be marked irrespective of training level. Therefore, the top score should be awarded to those who would be completing the tasks that the top level training accomplishes. Using the scale in this way allows comparison of trainees between training levels, as well as to track the progress of The final scale on the rating form is the global rating scale. This uses a numeric value to rate performance in a variety of categories. Each numerical value is anchored with a descriptive statement regarding its corresponding performance level. Again, the top score of 5 should be assigned to those performing at the level of an independent practicing surgeon. The scale specifies that trainees are to be marked irrespective of training level. Therefore, the top score should be awarded to those who would be completing the tasks that the top level training accomplishes. Using the scale this way allows comparison of trainees between training levels, as well as to track the progress of a single trainee over time. For suturing, there's approximately 4 steps: placing the suture, the surgeon's knot, further knots, and cutting the sutures. Each category includes some key error terms. Ranking the trainees depends on how frequently they perform the errors described in these terms. For those with error in the majority of the 4 steps, they should score a 1 or a 2. For those with only occasional errors in 1 to 2 of the steps, they should score around a 3. And for those with minimal to no errors in any of the steps, they should score a 4 or a 5. Some of the error terms include unnecessary force or damage in respect for tissue, such as grasping the skin edges too roughly or jamming the needle through the tissue. Unnecessary moves in time or motion, such as when a suture falls off the instrument or difficulty grasping and cutting sutures. Awkward or inappropriate moves in instrument handling, such as handling instruments incorrectly or clumsy moves. And finally, trainees who are unsure of the next move in flow of procedure and who take a long time to move on or to complete subsequent steps. The overall scores should be an approximate average of the above scores. Looking at each individual variable, a 1 should be those trainees who were not able to perform the task on their own or who had significant errors in most steps. A 2 is trainees who were able to complete the task on their own but had multiple points to improve on or many errors. A 3 are those who perform competently with a few areas to improve on to perform better, and minor errors. A 4 is those trainees who performed well, with small things that could have been done for improvement and maximum performance. And finally, a 5, those who performed the task very well to excellent, with no errors, who would be considered at the level approximately of a practicing surgeon. Again, please refer to the reference cards throughout the assessments for full details on definitions and frequencies given in the checklist and global rating sections.